regarding Kashaya versus Kashayam tablet. The premise is that the Kashayam tablet manufactured by AVP, AVN, and then the Quatham tablet manufactured by Kottakkal Ayurveda Shala. So these are available for most part of the world, and the premise of Kashayam tablet is less dose, lesser amount of preservative, easy to fix the dose. Patient will not feel the bitter taste or discomfort while taking difficult tablets like Gugulu Tiktakam tablet and all. There are efficacy wise, there are like positive reviews and negative reviews I have heard from different doctors. I particularly usually use this Vasa Guluchiadi Kashayam and Patola Katurohanadi very frequently. Do you support this Kashayam tablet range of products, or what precautions would you advise, sir?
See, we have a lot of patients with different set of mindset. So, depending upon the type of client, we need to adjust ourselves to a certain extent to some time. Here, one of the important issues is highly palatability. That our most of the kashayas are very very bitter, and these bitter principles they are very difficult to consume regularly by many of them because they never and in their lifetime they have experienced of these bitter principles they have consumed. So, because of these reasons, a tablet is quite a good one because we can fix this issue of palatability. But readily availability of the medication to the system is achieved by kashayas. So, I usually prefer kashayas because of that reason. Second thing, in Ayurveda, we have been very clearly taught that rasas also has some effect on the body because Tikta Rasa is having the capacity to quench or suppress the kapha and pitta. So that nature, because if you want to mask it by putting some sugar or blocking it somewhere down the line, and we don't want to taste that because then we are maybe somewhere we are blocking the activity of the drug. So drug should be taken as it is. Better what Acharyas has said, that is the first one, primary one. When we are not in a position to consume that, we need some better alternative. Then what I believe is Kashayam, Kvata, or these tablets or the capsules, they are the best alternative to kashayas. So first preference will be for kashayas, and when kashayams cannot be handled by these our patients or clients, then it is better you can go for tablets or even capsules of the same kashayas. And technically speaking, if you want to prepare a kashayam tablet or kashayam this one, we need to boil the kashaya to some extent more than the regular when it is watery in nature. We usually go for padavashesha, astavashesha, ardhavashesha, something like that, these kashayams while preparing. But in order to make them to a bulk and in order to make them to a tablet form or a capsule form, we need to even boil to some extent. We need to evaporate the moisture, and then we need to add many excipients and even the powders of the same thing to make it a bulk one and granulate it and then compress it. So there are some issues even with that. So, but what I feel is kashayams as prescribed by our acharyas, kvatas, they are the different, very important type of dosage form. It has to be given priority. When a patient is unable to cope up with that, then it is better to go for a better alternative is the kashayam tablet or the kashayam capsule.
Yeah, especially what you said, the readily available medicinal principles in the liquid form. So as soon as we take it, in case of kashaya, the metabolism and the absorption of the medicinal principles happens really faster. And the second point you told is very right. Due to this Swiggy and Zomato and Uber Eats world, we have like totally not tasted any bitter things in our lives. Even in Yugadi also, where the neem leaves have to be taken, we do some jugaad, and we somehow skip the bitter part and add more of a jaggery part. So even in terms of acclimatizing the patient and encouraging the patient to include all the shed rasas, all the six states in the diet also, the kashaya is a tool for that as well.
Definitely. That usually I start with my patients with the communication. That's the one thing. See, I can handle your condition provided you take my medicines. My medicines are bitter. Are you able to digest it or take it? Then only I will start a treatment. So when usually patient is in pain and conditions, they'll say, Doctor Saab, just you give whatever you want to give, I will take it. I am ready to take it. That's what they usually tell. But once they start it, then they'll say, this is too bitter. Then they'll all comments will then they'll ask for, once they're somewhat feeling better, then they'll ask, so Doctor Saab, do you have any better alternative for this? Can I skip this? So all these questions will arise later stages. But usually when they are they're finding a good result, usually they will follow.
Do you advise mixing the kashaya with a little bit of jaggery or honey if the disease and the rules are followed? No.
No, I usually I don't want to change that the concept of consuming that bitter principle. Bitter principle has to be experienced by that patient. So I don't want to give them any other thing. Only in some patient where there is too much of pressurization can't help it, then I allow them to mix it with some syrupy based materials, particularly for kashayams, livamin or something like that, abrigo leaf or something like that. A syrupy based material I usually add.